This is about the pitta अथात पित्ताभिच्छिन्न प्रतिषेधं व्याख्यास्यामः यथोवाच भगवान् धन्वन्तरिः पित्तस्यन्दे पैटिके चाधिमन्ते रक्तस्रावः स्रंसनं चापि कार्यम् अक्ष्णोः सेक आलेपनस्याञ्जनानि पैते च स्यात् विसर्पे विधानम्. Now in the pittaja abhishyana and pittaja adhimanta, raktamokshana and sramsana, that's virechana, are suggested. And akshisheka or lepana, anjana, and any of those medications which are prescribed in the visarpachikitsa are to be followed. Gundram, shalim, shaivalam, shailabhedam, darvim, yelam, utpalam, rodhamabram, padmat, patram, sharkara, darbhamikshum, talam, rodhram, retasam, padmagancha, द्राक्षां क्षौद्रं चंद्रम यष्टिकाहं योषिक क्षीरं रात्र्यन्ते च पिष्ट्वा सर्पिसिद्धं तर्पणे सेकनस्य शस्त्रं क्षीरं सिद्धमेतेषु चाजं योग्यो वर्गो व्यस्त एषो अन्यथा वा सम्यक् नस्य अष्टार्धसंख्येऽपि नित्यम्. Now the drugs which could be used in case of pittaja vyadhi, all of them are the shita dravya like gundra, shali, etc., which are to be pasted with the breast milk or goat's milk, and can be given in the form of akshitarpana or seka or nasya as such. In any number of these variations of these drugs, either maybe 4 of these, 8 of these drugs could be added to, and a preparation can be made. Kriya sarvaha pittaje prashastraha trihatya urdhum kshirasarpishyanashyam. The first 3 days any of the pittahara treatment has to be followed, and then if there is any residual issue, then you may give milk and ghee in the form of nasya. Parasham syat shonitam chanjanarthe shallakya va sharkara kshodra yuktam. The other specific medications which could be used are for anjana, parasha kshara or parasha kshira. Rasakriyam sharkara kshodra yuktam palindyam madhukve vapi kuryat. A rasakriya of either sharkara kshodra with the madhuka. Then musta fenah sagarasya utpalam krimigna yela dhatri bijadrasascha. Another of the preparation could be with the musta and sagara fena. This shell, seashell as such, and powder of that, and the vidanga, yela, etc. Talisha yela gairika ushira shankhihi evam minja danjanam stanyabhistehi. Another of danjana which could be prepared with the breast milk and talisha, etc. Churnam kurya danjanarthe raso va stanyopeto dhataki sendanabhyam yoshik stanyam shatakumbham vidhrishtam chhadrapetam kaishukam chapushpam. Another of the yoga which can be used for anjana. Rodhram draksham sharkaram utpalam cha narya kshire yastikahvam chamcha Pishwa kshire varnakasya tajam va toyon mishre chandana udumbare cha. The majority of the drugs, the medium of administration is the breast milk, and many of these sugandha dravyas and pittahara shila virya dravyas are to be used. Karyapyenah sagarasya anjanarthe naristanye makshike chapi ghrishtaha yoshik stanye sthapitam yastikaham rodhram draksham sharkaram utpalam cha. क्षौमाबद्धं पत्यम आश्चोतने वा सर्पे घृष्टं यष्टिकाहुं सरोध्रं तोयोन्मिश्राः काश्मीरी धात्री पथ्याः तद्वच्चाहुः कट्फलं च अम्बुनैव. Now these are all the different drugs. Ahifena or maybe this seashell saga fena pasted with the breast milk or makshika. These also are used for the anjana, and then it could be any of the ashtotana with the again breast milk and madhuyasti, rodha, draksha, etc. Yesho amlakhyo anukramaschapi shukto karyasarvaha syapchira mokshavarjyaha. Similar protocol of the treatment also can be done in shukta amla, the other variety of the disease, as well except the siramoksha, raktamokshana is not done in that condition. Sarpipeya trifalam tailvakancha peyam vasyat kevalam yat puranam. Purana ghra is another of the suggested treatment along with the trifala and the tilvaka as such. Then dosho adhastat shuktikayam apaste shite dravye anjanam karyamashu. Virechana also is suggested with the shita dravya anjana. वैदुर्यं यत् स्फाटिकं वैद्रुमं च मोक्तं शाङ्खं राटितं शातकुम्भं चूर्णं सूक्ष्मं शर्करा क्षौद्रयुक्तं शुक्तिं हन्याद् अञ्जनं च एतदाशु. Many of these animal shells as well as some of those minerals like Vaidurya, Spatika, etc. These also can be given in the form of a paste and then administered in the form of anjana. Yunjat sarpihi dhumadarshi narastu शेषं कुर्यात् रक्तपित्ते विधानं यच्चैव अन्यत् पित्तहृच्चापि सर्वं यद्विसर्पे पैतिके च विधानम्. In the धूमदर्शी conditions also the similar protocol of the treatment as well as any of the rakta pitta hara chikitsa can be done and visarpa chikitsa also can be done. With this the pitta abhishyana chikitsa chapter is completed, 10th chapter. As the next we will take up the kaphabhishyana श्लेष्माभिष्यन्द प्रतिषेधं व्याख्यास्यामः यथोवाच भगवान् तदनन्तरैः. छन्द अधिमन्तौ कफजौ प्रवृद्धौ जयेत्सिराणाम् अधमोक्षणेन स्वेद अवपीडन अंजन धूमसेक प्रलेप योगैः कवलगृहैश्च रूक्षैः तथा आश्चोतन संविधानैः तथैव रूक्षैः पुटपाकयोगैः त्रयः अपतर्पणान्ते प्रातस्तैव तिक्तघृतं प्रशस्तं तदन्नपानं च समाचरेद्धि यच्छ्लेष्मणो वा श्लेष्मणो नैव करोति वृद्धिं. Now in the kaphaja adhimanta and abhishyanta the raktamokshana is done and the sweda also is done. Now sweda, in when it comes to the question of contraindications for the sweda according to the locations, eye is one of the area where sweda is not contraindicated, but in case of the kaphaja adhimanta it's indicated. Maybe the justification is it should be mrudu sweda. Then avapidanasya anjana dhumapana seka or even local sheka pralepa application as well as kavalagraha. These can be the other protocols of the treatment in case of the kaphaja abhishyana. Then rukshehi, with the ruksha dravya ashchotana can be done as well as ruksha putapaka can be done, and apatarpana has to be done. Apatarpana like virechana has to be done once in 3 days. Treha apatarpanante. Apatarpana can be done with one interval of 3 days, once in 3 days. Pratastaivahu tiktagritam prashastam. Then tiktagrita is also suggested in such conditions. And any of those food substances which do not aggravate the kapha are suggested as the treatment. Then other specific yogas are Kutannata, Aspota, Panvijhaka, Bilva, Pattura, Piru, Arka, Kapithabhangehi, Swedam Vizadhyata. Swedanam with these drugs can be suggested. Atha Anulepam, Barhishta Shunthi Surakasta Kustehi, Anulepa with the Shunthi Suraka Devadara, etc. Sindhutta Hingu, Tripala, Madhuka, Prapondarika, Anjana Tuthadamrehi, Pistehi Jalena, Anjana Vartaya Syuhu, Patya Haridra Madhukanjanirva, Trini Ushnani Trifala Haridra Bidanga Sarascha Samanischa Syuhu, Barhishta Kushta Amarakashta Shankha Patha Amala Byosha Manashilascha Pishtva Ambuna Kusupcha Kusumani Jati Karanja Shobhanjana Jani Jinjata Phalam Pakiyad Athava Pashigroha Pushpamcha Tulyam Brahati Dvayasya Rasanjanam Saindhava Chindanam Saindhava Chandanam Manashilale Lashram Chatulyam Pishtva Anjanarte Kapajeshu Thiman Vartihi Visadyat Nayanamajeshu. The other Varti as well as Anjana prepared with the Tishna Dravyas like Saindhava Lavana, Hingu, Trifala and Trikatu and even Shigru Pushpa and Shigru Patra. These are Shobhanjana is a Shigru Patra and Shigru Pushpa, flowers of the Shigru. Also are suggested as one of the standard protocol of the treatment. Now as far as the Shigru Swarasa or even the Shobhanjana, these are now, even now they are still being used as the better options in the eye diseases as such. Roge balasagratiche anjanam cha anjanam jnehi kartavyam suvishuddhakaye नीलान यवान गव्यपयो अनुपीतान शलाकिन शुष्क तनून विदाक्ष्य तथा अर्जक आस्पोतक कपित्थ बिल्व निर्गुंडी ज्याति कुसुमान चैव तक्षार वैत्सैन्धव तुत्थरोचनं पक्वं विदध्यात् अतलोहनाड्यां एतद् बलासघृतिते अंजनं स्यात् येषो अनुकल्पस्तु फणिज्जकातो. Now in the chapter related to the abhishyana, Sushruta refers to many other diseases, and more specifically in the next chapter, the Rakta Abhishyana, almost the whole of the chapter would be dealing with many other diseases where medical treatment could be done. Similarly, in this present chapter also, Sushruta refers to the conditions like Balasagrachita as well as Balasagrachita conditions as such, where the options of the treatment are done after the Shodhanam and Yava, Nira Yava, along with the milk, and maybe the other options of the treatment in Balasagrachita. That's where you will have hyperkeratinization. The curating is done. Shalakirah Shushkatanun Vidasha. Curating and cautery is suggested by Sushruta. Of course, in the present day situation, curating is not an option of the treatment. Surgical excision is done. Then it could be like the other drugs like Ardaka, Aspota, many of the Kapara, Ushnavira Dravyas are given as in the form of Anjana. Then Mahaushadam Magadikam Mustam Sasaindavam Yan Marichant Shuklam Tan Matlungas Rasayana Pistam Netanjanam Pistakam Ashuhanyata. Pistaka is again the hyperkeratinization issue. In that condition again Sushruta suggests about a lepa, Anjana, with the Shunthi and Pippali, Musta, Saindhava, Maricha, Trikotu as such, and with the Matulanga Surasa. फले बृहत्याः मगधोद्भवानां निधाय कर्कं फलपाककाले स्रोतोजयुक्तं तद्घृतं तद्उद्धृतं स्यातं यत् पिष्ठे विधिरेषजापि. The other would be Bhrati Phala and then Hingu, this with these Gugulu, Gugulu, these are applied in the form of Vanjana. Or Varta Kashiguru Indrasura Patola Kirata Tikta Amaraki Falesho Kasisa Samudra Rasanjanani Jatyaha Tata Ksharakam Ematvachapi Taklin Vatmani Upadishyate Yoganjanam Tatmadhuna Avagristam. In Praklina Vatma conditions, another of the Anjana, that's called as Yoganjana, with the Kasisa, this Samudra Lavana, Rasanjana, Jati flowers as such can be used. Nadayam Agrim Marichant Shuklam Nepala Jata Hasma Pramana Samatulum the Drava Yesha Yoga Kandum Nihanyatu Sakradanjanena for the conditions like which results in itching in the eyes. Nade is Saindhavalavana with the Maricha and this Shukla Shilajitu. Nepal Jata is Shilajitu, a white variety of the Shilajitu with the Matalunga also has to be prepared as such, and it can be in the form of Anjana. Sashunga Veram, Suradamustam, Sindhu Prabhatam, Mukulani Jatyaha, Sura Pravishtam to Ilamanjanam, he Kandvam, Chashofe, Chahidam Vadanti. Another of the yoga for Anjana, where again Devadaru, Shunthi and Saindhavalavana, etc. A very irritant and pungent substances are used. Chanda Adhimanta Kramamacharetyo Sarveshu Chayeteshu Sada Apramattaha Visheshato Namaneme Karyam Sansajam Chapi Yathopadishtam. In Sanda Abhishyana Adhimanta treatment, you have to mainly depend upon Namana, that Nasya and Samsarjana. Now, it looks like the whole issue of the Abhishyana is discussed in detail, too much of detail. The varieties like Vataja, Pittaja, Kapha, of course, the Raktaja is in the next chapter. Now, we will have some conclusion about the conjunctivitis now, then really reserving it to the next chapter, because in the next chapter, Raktabhishyana, Sushruta discusses about more of the other diseases than really the Abhishyana. Now, in the Sushruta Sutrasthana, when it comes to the question of Aupasargika Roga, Abhishyana is mentioned as one of the Abhishyana. Prasangat Gatra Samskrishata Nishwasatha Bodhanatha Shaya Sarajjapi Vastram Adyanule Parat Kushtam Jurascha Shofascha Netrabhishyandevata. Netrabhishyanda is considered as one of the Aupasargika roga. Whereas in the Uttaratantra, that Aupasargika component, a possibility of spreading rapidly, is not really mentioned. And generally, in general, when we say conjunctivitis, it always, in general, it's a believed that it could be related to the viral conjunctivitis, which we call as Madras eye, pink eye, or so on. And this condition looks like a relatively a self-limiting disorder. Most of the times it doesn't really result in major complications, and it's a transient issue for about a week or so, or 1 or 2 weeks, and we generally consider this as a relatively simple issue. Most of the times in the society, some drops are applied over the area, or many times it could be like even Dhanya Kahima, or maybe even the rose water, etc. They are applied locally, and the whole condition is seeming to be like a relatively mild condition. So it looks like whether Sushruta has exaggerated about that as such. It's not true that it's not exaggerated. Rather, if you know about the possible complications as well as a possible variety of the conjunctivitis and the importance of the conjunctiva. Conjunctiva is a very crucial membrane in the eye and very crucial structure. Though it looks like a very simple temporary or simple transparent membrane, it's like having almost 5 layers of the epithelium which are highly specialized, which keep it transparent, and then there are multiple glands which add to. It's not only the lacrimal glands, you have many of those glands like Henle's glands and man's glands and so on, which would have many secretions which keep the eyes clean as well as prevent any septic complications. Many of the growth of organisms in the eye is prevented by the secretion of the glands. It is a highly protective area. And the structure of the conjunctiva also, over the palpebral surface, the structure is slightly different, and it's relatively thinner, and it has more of secretions. Whereas over the scleral surface, it's the limbus. There is a small space which is where some fluid could be collected, and that again can be a cause for the complications. The growth of these epithelial cells and maintenance of the hygiene of these epithelial cells also is a very crucial issue in keeping the eyes healthy. If there is any variation, the growth can be affected, which can result either in atrophy or maybe the keratin tissue development, and keratin tissue development can produce complications. Even those conjunctivitis, which is often presented with that red irritation in the eyes, it could be of different origin. Viral, of course, is the most common variety, which we consider as something like epidemic or endemic, which tends to spread rapidly, which is well known, and almost everyone might have experienced it at one or other type. But all those conditions where the patient presents with the irritation in the eyes is not viral conjunctivitis, and many of them could be serious complications, and they could be of bacterial origin, fungal origin, parasitic, then toxic, chlamydial infections, chemical, allergic conjunctivitis also are quite common. Many of these cannot be easily differentiated clinically. Only when the course is longer and which doesn't respond to the usual treatment, then only it can be made out. Bacterial conjunctivitis and parasitic conjunctivitis, they may be presented with the lymphadenopathy, which can help you to make the diagnosis. Chlamydial is a venereal infections, which again can result in pus formation, and even this infection may spread into the whole eyeball, and the serious complications can occur. Chemical conjunctivitis, again, it's also now one of the common issue in case of the industrial situation, or with the current level of pollution. Chemical conjunctivitis also is one of the important issue where the treatment becomes quite difficult. And because of these variations, and many of these variations could be applied to what Sushruta considers in the form of the dosha lakshanas. And based upon that, the conjunctivitis now can be classified as allergic hemorrhagic conjunctivitis, simple allergic conjunctivitis, where there is not much of a hemorrhagic status, bacterial conjunctivitis, giant papillary conjunctivitis, neonatal conjunctivitis, where newborn at the time of the birth itself there could be conjunctivitis, viral conjunctivitis, atopic keratoconjunctivitis, epidemic keratoconjunctivitis, and keratoconjunctivitis sicca, which we have already referred to, superior limbic keratoconjunctivitis, and so on. The varieties of these could be presented with the different courses of pathology. And maybe to a great extent, the variations according to the doshas mentioned in Sushruta can be applied to these conditions to a great extent, like raktabhishyana in case of the acute hemorrhagic conjunctivitis, allergic conjunctivitis as kaphaja, bacterial conjunctivitis, pittaja or the vataja, and viral conjunctivitis is quite obviously vataja. Atopic keratoconjunctivitis also could be considered as vataja with the complications like the keratinization, which makes it ruksha as well as thinner. And then epidemic keratoconjunctivitis also is a variation of the same, where there would be a rapid spread of this, which is also often origin due to the virus, but the species of virus could be different, and it could be considered as dvandaja because of the course. And keratoconjunctivitis sicca, where there will be dry eye pathology, is obviously vataja. Now, in these conditions, many of those yogas, which seem to be quite elaborate, see, number of yogas, anjanas mentioned in Sushruta, they are quite huge. Looks like as if all these are really necessary or not. And in the present day situation, where you have plenty of these eye drops, variations of the eye drops, like, and the classification of the eye drops are primarily, majority of them would be having antibiotics in their content, and the next common is steroid containing drops, which will reduce the inflammation, and then you have the decongestants, which can reduce the congestions. So the majority of the eye drops which are used now are of mainly these three categories. And many of those anjana yogas, or maybe the yogas like tarpana yogas mentioned in the Samhita, they may also have a similar property, but more elaborative research study can be done, and it could be very huge resource for the thesis writing in Chalakya post-graduation maybe, and lot of study can be done in this issue. So it's not that whatever Sushruta has mentioned in the terms of that abhishyana in detailed 3 or 4 chapters is not a waste as such. It's not in exaggeration. All of them may have a relevance, but a more detailed study is required. And with this, we will conclude about the conjunctivitis, though in the next chapter Sushruta refers to raktabhishyana. As I have mentioned earlier, there more than the abhishyana, the other diseases are mentioned, and their treatment protocol is mentioned, and hence we will limit our discussion to those conditions as such. With this, we will conclude this chapter also. Ili Sushruta Samhitayam Uttaratantrantagate Chalakyatantre Kaphabhishyana Pratishedo Nama Ekadasho Adhyayah. So 11th chapter is over. So we have completed 2 chapters, and we will end up today. If there are any questions, we will try to answer. And then there is a question like the treatment protocol to follow. What is the treatment protocol to follow in viral conjunctivitis, in the sense epidemic viral conjunctivitis? See, as I told you, in the epidemic viral conjunctivitis, virtually there is no need of any specific curative treatment, medical treatment. The only thing is you have to reduce the irritation of the eyes. To reduce the irritation of the eyes, maintenance of the hygiene is important. Clean water is washing the eyes with the regular clean water also is quite good enough. And another one of the common yogas or common substance which is used in the folklore as well as in the regular practice is dhanyaka hima, not dhataki, dhanyaka hima, dhanyaka kottambri, and that it's kept in water overnight, and that water is poured into the eyes. Drops that could be used. Rose water is another of the thing. Triphala Kvata also can be used as such for local. So majority of the situation, the treatment would be local. Even in the contemporary situation for the viral conjunctivitis, the treatment is mainly local. And in the present day situation, as I told you, you have that different options of the treatment, like maybe the decongestants, antibiotics, and then the steroids, Of course, the steroids are not really indicated in case of the viral conjunctivitis, but to reduce the symptoms, they could be the other substances which are used. The treatment protocol for the keratoconjunctivitis, there is a keratin tissue occurring. Virtually, there is no curative treatment now, and majority of the patients may have some vision problems persisting for a long duration. Now, that's an area which I suggest, though I don't have a direct experience. I don't have a experience of treating those conditions directly, but many of those yogas which are mentioned in Sushruta could be tried in such conditions, and maybe that's what I said, like could be a subject for the your thesis subjects in Shalakya. Many of these yoga, Anjana yogas could be tried in keratoconjunctivitis, which is next common. So it's not as common as the viral conjunctivitis, but one of the problem where we may not have a definite solution as such. So as far as the keratoconjunctivitis treatment is concerned, I don't have any direct experience as such, but still I think that could be one of the area where we can do something if you do a study in that issue. I think, right? So any more questions? No. So we will wind up today and continue with the next chapter in the next class. Sorry.